Hello everyone, welcome to Within the Frame. I'm Kim Bo-kyung. The Yoon administration has made a firm decision to increase the number of medical students by 2,000 starting next year. South Korea's medical school quota has been kept at 3,058 since 2006. Such a plan has been drawn as the country suffers from shortages of doctors, not just in rural areas, but also in essential areas of medicine. Measures to appease doctors have been unveiled several days ago, but still, doctors' associations are fiercely opposed to the increase, vowing to launch a nationwide strike. To better understand doctors' position on this issue, we invite Professor Kim Moon-kyu from Yonsei University College of Medicine. Welcome to the show, Professor Kim.
Thank you for having me.
And we also have Dr. Alice Tan, an internist at MizMedi Women's Hospital. Good to have you with us again, Dr. Tan.
It's a pleasure to join you tonight.
All right, first question to our Professor Kim. Now, before we get to the details, the government is saying medical reform is necessary, considering an expected shortage of some 15,000 doctors by 2035. Could you tell us what data this number is based on?
Well, I think according to the OECD data, commenting the doctor population ratio, which is about 2.6 per 1,000 people. It's quite lower among OECD countries. And if I let you know one more data about the comparison, the hospital bed population is 12.4 per 1,000 people. It's the highest among OECD countries. So you can see there's some controversy within the OECD data. And before we go further, I would like to point out it is not a good idea to oversimplify a complex subject using simple factors. There are so many factors to consider when you want to compare one country's medical system to another. And some people point that the physicians working at primary care service is only 6% in Korea, when OECD other countries average is about 23. And they insist that we need more physicians serving as a primary care physicians. And one of the reasons of these differences is that most of the doctors in Korea are specialists with a board certificate, and it's quite different from other countries like UK and even United States. So I can say that the Korean people, they are meeting many qualified doctors with board certificate compared to other countries. They were already experiencing high quality medical service right now. The shortage of doctors, we have to think about it, but we must not miss the point. And we have to discuss which is the important thing we have to fix right now.
Right. As you have already said, we should not oversimplify the data, but the government is strongly believing right now that there is a severe doctor shortage, and so it announced the medical school enrollment quota to be increased by 2,000 today, starting next year. This is like the first hike in 19 years, Dr. Tan, up from 3,058. Now, how is this number compared to other countries, in your opinion?
Well, if we look at the data compared to other countries, so 11 countries that are both in the OECD and also G20 countries, these are 11 countries, the average number of medical graduates per 100,000 population is 12.15. However, in South Korea, we rank the lowest among this group of 11 countries, so the countries that are both in the OECD and the G20. And our number of medical graduates per 100,000 population is 7.260. Of all the OECD countries, however, Israel does rank the lowest. It stands at 6.800. If we look not just at the number of medical graduates, but also the number of doctors, according to the World Bank, South Korea also has the fewest number of doctors per 100,000 people, fewer compared to the OECD average. The OECD average is 3.4 doctors per 1,000 population. South Korea's number is 2.5. So if we look at just the numbers, we are on the lower spectrum in terms of the number of medical graduates per population.
Oh, right, I see. I mean, we should consider some of the unique characteristics South Korea has regarding this issue, but I believe it is true with the number itself, we are in the lower spectrum of the number of the doctors, like our Dr. Tan said. And Professor Kim, so to the government's plan, Korean Medical Association has vowed to launch a nationwide strike. How has the reaction been from doctors' groups, and what are they worried about?
Well, I don't know how they reached the number of 2,000. I'm not against the policy to increase the number of doctors, but we have to fix to the point, the main point of the current problem. The shortage of doctors is usually in the area of essential or critical care service, especially in regional area. There's no guarantee that the increase of annual enrollment quota will solve this issue. If there is a clear evidence for shortage of doctors, both sides can come to the table and discuss. But we do not touch the root cause of this issue. So I'm worried that the wrong approach can make bad situation even worse.
All right, I see. Root cause should be topped on. I cannot agree more. Now, Dr. Tan, to appease doctors' groups, the government previously announced policy packages for them. And so I'd like to ask our experts some of those. First of all, the ministry aimed to reduce the continuous working hours of medical interns and residents and to reorganize medical institutions with specialists rather than trainees. Do you believe this would work?
Well, there's good evidence that judgment and reaction time and cognitive ability in general, that they all go down with sleep deprivation. Just like we don't want sleepy pilots in the cockpits, we don't want sleep-deprived doctors who are making, very important medical decisions and performing procedures that have huge impacts on patients' safety and health. Back in the U.S. In 2003, as part of healthcare reform, the residency work hours were restricted to 80 hours per week, and one shift could go no longer than 30 hours. And so they put these restrictions in place. Studies have shown, however, subsequently that despite these restrictions, internists who trained under these restrictions, there was no difference in patient safety outcomes, but there was an improvement in resident physician well-being once these restrictions were put in place. So I think there is good evidence that putting in a restriction in terms of the continuous number of work hours that residents are allowed to work, it's good for patient safety and doesn't really have any downsides in terms of quality of training or the cost of care in general.
All right, I see. So putting restrictions cannot solve all of the problems, but it will definitely, it is definitely necessary in your opinion. I see. Now, Professor Kim, President Yoon also promised to reduce the legal burden on medical professionals as well. To what extent have medical personnel suffered from such complaints and accusations, and would this in any way negatively affect patients' rights?
Well, as I mentioned, usually the legal issues happens in a critical care service, emergency department, such as that. I don't know why doctors are charged with criminal lawsuits. Is there a doctor having a criminal intention when they care for the patient? I don't think so. When I was young, medical lawsuit usually starts with may start with a criminal lawsuit, but the judiciary promptly declined criminal lawsuit because it was evident. And the plaintiff may initiate a civil lawsuit, and they go through a long process of negotiations, and it might end. Because doctors usually never have intention to harm patients, I think a criminal lawsuit is something unacceptable in most of the cases. But nowadays, the plaintiff starts with a civil lawsuit, and if the trial concludes unfavorably, sometimes the plaintiff may file a new lawsuit as a criminal lawsuit, and the judiciary accepts such filings. Recently, there was an emergency medicine doctor lost his medical license because he missed a case of dissecting aneurysm, which is a very urgent and critical disease, when he was at the first year of training. So these kinds of news makes many doctors discouraged to take that training or be involved with critical care service. If I was at his position, I might also have missed a case. So this social trend discourages doctors, and even though we increase the number of the doctors, still nobody is not going to want to work with that dangerous areas which might be involved with lawsuits. So last week I listened to the television program with President Yoon mentioning his experience that there was an immense burden for doctors to be summoned to the court several times for a long time, several years. So I wish that this legal system could address and improve somehow.
Right. So to some point, I guess we would have to lift this legal burden from the doctors. I see your point. Now, Dr. Tan, one of many concerns was the worsening regional medical staff shortage. And so apart from increasing this enrollment quota, the government came up with a so-called long-term contract system to secure a local medical workforce. Now, what is this about, and could this be effective?
So basically, the government will sponsor a certain number of incoming medical school students during medical school on the condition that they work for a certain number of years in a rural or remote medical setting. That's kind of the condition for getting a scholarship and getting a spot in medical school. Now, Australia does have a similar program in place already. It's called the bonded medical program, in which doctors are required to fulfill a bonded return of service of 3 years if they have enrolled in the system. Ultimately, I think the ideal goal would be to have a doctor who lives in the community, knows their community, in addition to caring for that community. But right now, the demographic trend is for young families, young people in general, to move out of rural areas, and there's really a centralization that's going on in terms of the Seoul capital region for education, for job opportunities, for housing. And so I think if we want, we talked about this before, we want to address some of the root causes of what's going on. Decentralization, perhaps of the society culture and structure might be one way of addressing this issue. Also having a physician pool, this was part of the package, physician pool so that doctors can, say, volunteer to work in rural areas for a certain number of years, and then we have a rotating staff of doctors who will go in and work in these regions. So these are, potential solutions, but I think ultimately, if we think about, why are people, including doctors, moving out of the rural areas? If we improve housing, improve education, and then set up, say, a beautiful, sophisticated, cutting-edge hospital, in one of these regions, then people may feel incentivized to go and live and work there. And that would be an incentive for doctors as well. We have to make sure that if a young doctor goes to work there, especially a female doctor, that childcare is affordable, high quality, and education in terms of the quality and the opportunities for education in that region are in place so that doctors feel comfortable and safe and happy living and working in those communities.
Right, I cannot agree more. Decentralization and reducing this regional gap of population would be definitely necessary for South Korea. Well, Professor Kim, along with that measure, the Yoon administration aims to expand the regional talent admission system to 60%, which for now selects at least 40% of the medical school seats for local students. But as far as I know, weren't many of the students already selected from their own areas?
Yes. Before we mention about the percentage of regional students, I think it is a good idea to let regional high school students to have more chance to be enrolled in medical school. But after finishing medical school, a big portion of them leave the region and go to the bigger cities to be trained as a resident in a bigger institutions, which might have a higher, updated, high-level training. And even though he's from the regional high school, from the regional medical school, still many young doctors move to the bigger city. So, well, I'm not sure the portion of the regional students might change this effect. Well, I do wish that we could empower more. I mean, empower the regional training hospitals. So let the doctors be attracted to that hospital. And also the patients should be attracted to those hospitals. In the last conference with President Yoon, I saw a patient living in a regional city, diagnosed with breast cancer, I guess. And she insists that she has to visit Seoul many times, even many times a week. And she was asking for some kind of stay house or something to let the patient stay during the treatment in Seoul. But I think that's not the point. I mean, if there's a same facility and doctors who can treat her, she might have something treated in Seoul, but the rest of the treatment does not necessarily be at the same hospital in Seoul. She may visit the regional hospitals also. So I wish the focus will go with the empowerment of regional hospitals.
Right, empowerment of regional hospitals. I cannot agree more. Well, Dr. Ten, another major issue the country needs to deal with is securing doctors in critical but less popular departments as well. The government promised to invest more than 10 trillion Korean won, or around $7.5 billion of national health insurance reserves to increase compensation for them. What is your view on this?
Well, I'm glad that this was brought up. I mean, the simple fact is that there is an economic aspect to the practice of medicine that needs to be recognized and addressed, and neglecting the business needs of running a clinic or a hospital will only lead to closure of more medical centers that provide essential services such as pediatric care and OB care, emergency care. Now, part of this trend of closures of hospitals may be a reflection of sort of the demographics of what's going on, supply and demand. I mean, South Korea has an exceptionally low birth rate, and so you would expect fewer women to give birth and fewer babies to be born, fewer pediatric patients that need to be taken care of. And so if we look at, again, what's the root cause of, say, pediatric clinics closing or OB hospitals closing, if there aren't patients, if the demand isn't there, then, it's going to be hard to maintain hospitals. And so looking at the root cause and addressing these root causes, I think, is very important. Gender equality, lack of affordable and high quality housing, lack of affordable childcare. We talked about educational opportunities as well. These are social aspects to this very complicated issue that also need to be addressed. And also in terms of investment, not only do we need to invest in regional medical hubs, I think we also need to invest in a mobile medical transport infrastructure, including air ambulance and regular ambulances that are equipped with all of the highest level of technology, so that life-saving care can be started with remote monitoring, and it can be started in the ambulance by highly trained emergency medical technicians. We need to use a better sort of a data communication network so that when a patient is identified, they can be transported to a regional medical center quickly and effectively, and so that they can receive the life-saving treatment that they need. And so there's a lot of technology, I think, that can be put into action that needs to be invested in, not just in money in, say, into clinics, but addressing the issue of where is the need and how do we address the needs that we've identified, instead of, say, putting in money into services that aren't needed in certain areas. For example, if you build an OB hospital in a region that has no women of childbearing age, that's a total waste of money, right? And so we do need to identify what are the needs, why are there deficiencies, and address those specifically.
Right, I cannot agree more that we need to identify, like you said, Dr. Tan, the core reasons, the root causes of this issue and address them properly. Well, I'd like to ask many more questions for our experts, but unfortunately, this is all the time we have for today's edition. But thank you, Professor Kim and Dr. Tan, for your time and insights today. We really appreciate it.
Thank you.
Thank you.
All right, that's all for Within the Frame tonight. Thank you for watching, and goodbye.